Again, my name is Justin Otzi. I'm a planner with ARDC. Here to talk to you about a little integrating health into local planning. I like to work really informally, so if you have a question of something I said or need me to clarify a little bit more, feel free to just let me know, raise your hand, or just interrupt me with a question. Real quick, I think I heard a visioning session going on, or kind of visioning session from Marais or the other entities going through a comprehensive plan update coming up soon, or?
We just finished our comp plan update.
Just finished it? Okay. Land use, okay. And then visioning session, Grand Portage, anything going on, or kind of down the road maybe? Sure. Sure. I was just curious for my own interest, trying to gauge who I'm talking to a little bit. So a bit of an agenda. I'll just touch on comprehensive planning and our process, just a little bit of background in case you're not overly familiar. I'll outline the collaboration of this pilot project that we put together. As Kristen mentioned, my ex-coworker now, Ellen Pillsbury, helped kind of formulate this whole thing, worked with me as we put it together. And then examples of areas incorporating health into comprehensive plans. There's a couple of different communities that we worked with as a part of this pilot project. And then just kind of outlining the lessons learned and some conclusions and next steps. So real quick, just to kind of get people talking a little bit, I just wanted to warm up and just feel free to blurt it out, but something we do at the visioning sessions that we've invited public health to is ask people, how does their neighborhood or their city improve their health?
I go in the ditch a lot on my really bad road, and so I get a lot of exercise getting my car out of the ditch.
There we go.
I think for Grand Portage, our food sovereignty is a huge part of our health.
Definitely.
Now I can walk on the safe sidewalk to the farmer's market on county land over by the community center on Thursdays in the summer.
Awesome.
So good. Just like you said, the DN food.
Yeah, the highway department has high priority in clearing sidewalks in the city as well for youth, especially walking to school.
Great.
In the morning.
Awesome. That's fantastic.
Thanks to the county and the city.
Yep.
We've got community activities, our active living concepts around Move It in February, Move It in May.
Yeah, a lot of active living, a little bit of food stuff too.
Fresh air.
Fresh air,
Community
yep.
gardens.
Surprising network for trails.
Right. How about hindering obstacles or barriers that your neighborhood or your community have that impact your health? It's just kind of another way to start kind of thinking about how this built environment affects your day-to-day choice.
Two breweries within 2
Doesn't help.
Oh, okay, got
Left
it.
turning lanes with less turn, we
Or
had
lack thereof.
conversations about that.
Right.
I think even though there's been some real good progress with sidewalks and clearing in the winter, or just in general, there's still room for improvement.
Sure. Anything else?
And in Grand Portage, as far as sidewalks go, the way our village is set up, sidewalks are sometimes not even an option. I mean, it's a new possibility.
Right, yeah, certainly. And that's just something you have to figure out something that, what to do with.
We live on a big hill,
You know?
and in the winter that hill gets really slippery.
Yes, big time.
Weather.
Right, cold weather.
And a highway going, well, actually not just through Grand Marais, but a highway that goes through most of our communities.
Right, yeah.
Part of our communities.
Definitely. Yeah, so this is just kind of an example, just show what we're talking about when we go to a public visioning session. We invite public health in, they give a little bit of background. I didn't necessarily do that. It seems like as an active living group, you've gone through that kind of connection and have that in mind. ARDC, real quick, for those who aren't aware, we're one of 11 regional development organizations put together by state statute. We provide technical assistance when it comes to planning, transportation and trail planning, land use and zoning, safe routes to school, byways planning, city planning as well, to different communities throughout our 7-county Arrowhead region. It's kind of a little bit, shows just what those layers are and how they build on each other when it comes to land use planning. A comprehensive plan kind of puts that base foundation, has that vision, and that ends up setting your zoning, potentially subdivision and plats are affected by that, variances, conditional use permits, and building permits and site plans as well. League of Minnesota Cities is an expression of a community's vision and strategic map or framework to reach that vision. We basically can include land use planning, public utilities, economic development, housing, demographics, resource assessment, land use zoning maps, basically kind of every little aspect that the city has some role in trying to create a vision for that. Background analysis, existing land use, demographics again, as I mentioned. Intergovernmental coordination is another big one. Basically, it's a way that we say that where we are today, get an outline of existing conditions, get a lot of community input, and to really work on bringing in the community engagement to kind of put together that vision of where we want to be and use the plan to try to help steer those steps into where we're going and how do we get there. Basically, I try to explain a comprehensive plan. It can be, really long range of what, that vision that you're looking at, and it's a living and breathing document as well. Basically, it's not, you get something adopted, it's not necessarily set in stone. Its priorities change on a year-to-year basis. It's something you can relook at. So our planning process, as projects start up, we establish a process, talk about, is it going to be 4 meetings, 6 meetings, etc. I'll get a facilitator. Usually in our role, we're already hired on as that. Talk about roles between the committee members. And we do a visioning session. We invite the planning commission and the public into a meeting, have food and go through some asset mapping and some other exercises for us to try to get as much information as we can about the city from the local people who live there. Because I can come into Grand Marais or Grand Portage and kind of get my perception, but being able to sit down with people who live in the community, have been there, a lot of the times in our communities, sometimes their whole lives or 20, 30, 40 years, that wealth of information is really valuable. So we get that, work on vision statement, exercises like that. Then we usually have a steering committee that we work with. We'll take all that information and summarize it and package it together, showcase that to the planning committee and use that to help inform our recommendations that we start developing. Working again with the steering committee, try to get that kind of solidified. Here's our action plan. And then we tie all that stuff together, the visioning information that we've got, any of the demographics or the other background information that we researched, as well as the action plan. Together, prioritize it. One really nice thing that we do is put each one of those action steps into kind of a matrix or a spreadsheet in the back of the appendix of the plan. So as you're going through year by year and annually updating it, you're not going back to chapter 6, transportation on page 47 and then lining out, we got this project done. It's really easy. You go to the appendix and you can just check it off, which is really nice. And that's something we recommend looking at annually, making that a public engagement opportunity as well when talking about reprioritization. So that is kind of what we were doing. That was our comprehensive plan process. The project I was going to highlight is Minnesota Healthy Comprehensive Plan Pilot Project 2015, has been extended to 16 due just to some delays with some of the comprehensive plan processes that we were undertaking. The opportunity we were assisting 20 communities in planning process due to some grant funding that just became available. We wanted to expand community engagement strategies, work in health data and social determinants of health into the planning process and to have that conversation in the planning process. Learn current food access and planning best practices. This is an emerging trend, or re-emerging trend, I guess, in planning, is how these two spheres, public health and planning, interact. So some of the project included technical assistance of going to trainings and other things like that, just to boost our own knowledge of what's going on out there in the country. And then we wanted to go bigger than just active transportation and start talking about all policies, whether that's community, things that are like more social interaction when it comes to playscapes or parks, zoning changes that can affect being able to have community gardens or urban agriculture, things like that, kind of broadening it out a little bit more than just active transportation, which was kind of our focus prior to this project. IRRB, many of you are probably familiar with. Again, this was kind of the reason that spurred those 20 planning projects that we had. I think the numbers increased since then. I mean, we've completed some, but basically they made a requirement for all their other grant funding to be eligible for that. They needed a comprehensive plan that addressed all 10 or 11 chapters that they outlined, Many communities, some hadn't had it, hadn't updated one for a while, kind of had most of the chapters, didn't have them all. But that kind of opened up the opportunity for us to try to work in some of these new principles into communities. Project partners, ARDC. There's a couple other components to this project as well. We wanted to do the pilot projects, work on the planning process with Healthy Northland and CHB, Community Health Board, and worked primarily in St. Louis County is where we were targeting. Basically, bringing them into the planning process and have them present some of this planning and health data. And just from a expertise professionalism standpoint, I could come up there and talk about how obesity rates are influencing the amount of money we're spending on public health, but to have a public health professional there helps my integrity big time, because you're a planner. What are you talking about? Having a professional there helps both my capacity, but also just working with the public, having them buy into this connection. Also, the University of Minnesota Extension and the University of Marais had a component of this. Another arm of this project was a food access survey on focus groups. So we're currently the survey's done. I'll get into the focus groups a little bit later as well. But they wanted to look at some trends and issues when it came to accessing food in some of these pilot communities. Tower and Mountain Iron specifically up on the range, who don't necessarily have a great access within their communities. So the goals: community comprehensive plan model that include encompassing health equity, food access, and health eating language into the plan. Trying to influence regional funders like IRRB and other places and other funders just on what kind of programs could help spur improvements in these areas. Potentially IRRB maybe making some money available to look at zoning changes for communities so they can actually undertake some of those things, because some of those details just get overlooked when it comes to the comprehensive planning process. Going through a town's entire zoning code can be a lot more detail-oriented than working on a comp plan process, so they're kind of separate projects. So hopefully being able to influence additional improvements later, and just a regional awareness of the economic benefits of community and health related policy language, and having that conversation during the planning process. So again, pilot health comp plan processes, Tower Brighting Township was the first one we selected. Kind of unique, a smaller community and a township and city partnership, which was unique too. Doesn't happen all that often. Mountain Iron we also selected, and the city of Proctor. So we kind of wanted to get a different gauge of different community sizes and areas. Proctor, we also wanted to go. They had just lost their grocery store not too long ago. So they were kind of, food desert's a term that's starting to not necessarily get used as much anymore, but they're kind of in that same vein. Again, I mentioned that food access study with the University of Minnesota Extension. That was a household survey that they sent out. And we'll also be doing a focus group and have a final report. And then an evaluation which will be a checklist that we'll put together at the end of this project from what we've learned. And basically be a 1 or 2 pager that you can pick up and look at, Marais or whoever's comprehensive plan and say, okay, do we address this? Do we address urban agriculture? Do we address complete streets or active living in our plan? And you can check off and kind of get a gauge as to how you're faring, and maybe also use it as an area of where you want to focus on if you want to incorporate some of these things. Here's just a quick thing about community indicators, and when it comes to health and wellness, you see access to recreation and open space, healthy foods, medical services, transit and active transportation opportunities, as well as safe neighborhoods and public places. And then this one kind of shows how those relate to all the different sections of a comprehensive plan. Access to affordable housing comes into housing. Access to public transit and active transportation is transportation. Some of them, completeness of neighborhoods, go through a gamut of things: ag and natural resources, transportation, recreation and open space, housing, economic development. So kind of all of these community wellness, health and wellness things fall into different chapters. And I just kind of wanted to show those connections real quick. So again, when we selected our pilot communities, we were just working with ARDC. Planning was occurring in the 15 and 16 year. And just, were you willing to be a part of this? Was this something that you buy into as a community? Do you want to have this conversation as well? All right, so just real quick rundown, City of Tower Brighting. We incorporated health in the visioning session, county health data and the built environment. So again, we brought in CHB representation to give a presentation on how these connections happen and what social determinants of health is. Basically trying to build that capacity of the steering committee that we're working with, as well as the public that are at that meeting, to help them get an understanding of why we're having this connection, why we're talking about community gardens under land use and stuff like that, and what the role the city has in that. I also did a community engagement survey as well. I asked a handful of questions. I have a couple of examples later that I'll just try to broaden out that ability to get grassroots and community input. Drafted goals and recommendations, and I think we're just finalizing the plan here shortly, if I remember correctly, and they will be adopting soon. City of Mountain Iron had a few delays when it came to undertaking their project. We started with one planner, he left, and then we had a little bit of time of turnover. They did as well. The delay ended up working out really great though. We just were able to do the public visioning session last month, or earlier in February, excuse me. And so initially CHB, when they were the SHIP coordinator in St. Louis County, there was 3 or 4 of them, but they were all based in Duluth. And so St. Louis County, as you all know, is a very large county. So there's a huge amount of population with no service at all. Well, in January, they just hired a new SHIP coordinator who's going to be based out of Virginia. So this delay of us not being able to kick off their planning process until 2016 helped out greatly, because now he was able to be at our visioning session and talk, start building that relationship moving forward. We also just put out a community engagement survey there as well, and we're working on drafting some recommendations based on what we got at the visioning session and survey results upcoming. Proctor is we just finished up our last plan review meeting. We'll be going public here next month for additional review, but the planning document itself is finished. This one was a little bit different. County and health data and the built environment stuff that I mentioned earlier was at a committee meeting. We didn't hold a public visioning session with Proctor because earlier that summer they had a Minnesota design team come in for a week-long workshop where they work with the city and public, and then have a long whole weekend visioning session with the community to help put together kind of that broader vision. So we didn't really want to recreate that. We took what they had and built upon it. We did put out a community engagement survey though, but we still wanted public health to be there to help broaden the capacity of the steering committee. Again, we drafted the entire planning document. We're going to ask CHB to be at the planning review meeting when the public does come to help just to help showcase what that connection is all about. Engagement questions at the visioning session. What are your community physical and social assets? What are your community concerns? Again, as I did earlier today, how do those assets or threats affect your health? So they'll start out, kind of build that capacity earlier on. Then we'll identify these issues and assets within the community on a broader level, then have that question of how that relates to health. And then again, in 20 years, our city is kind of help building that visioning session. One thing we tried to incorporate too at these visioning sessions was bringing some healthier food options. Too often, or really, what the standard used to be was always some donuts or a bag of chips or coffee at night. So we just wanted, granola bars, some nuts, clementines, water, and sparkling water. Just a little bit better options, because if you're going to be talking about health and doing all these things, it's kind of counterintuitive to have a bunch of donuts in the back. Community survey, again, is just an example of a poster that we put out to help promote the survey. Had it available online as well as paper copies at City Hall and other places within the community. Rate the importance of the following transportation factors: ease of driving, bicycling, walking, street and sidewalk maintenance, snow removal, transit. Again, similar when it comes to education and access amenities, healthy and affordable, quality food, etc. The primary sections for food access policy we found out has been land use, agriculture, economic development, natural resources, and sustainability. If that's a part of it, that's an emerging chapter. It's not required by IRRB, but more and more communities are having either a chapter or an entire plan on sustainability now. Some sample policies we found. Amend zoning to include definitions for specific food retail types, and increase access of fresh food by allowing small grocery stores as permitted use in all the city's commercial zoning districts. Some areas would restrict that, whether you used to have neighborhood commercial grocery stores just kind of on that corner there. That had been phased out for a little while, so maybe looking at moving that, amending zoning ordinances to allow livestock or chickens and bees and other urban agriculture are other areas that you can make impacts. Here are some that we had put together for the comprehensive plans that we had worked on. The goal being at the top, promote improved social and economic factors as food access, economic prosperity, educational attainments, and social clubs, and volunteerism. Again, getting at kind of that social connection thing I mentioned as a part of health as well. Also looking to promote and support food access, such as a local grocery store or food shelf and farmers market. You see community gardens in there. Creating an active living plan as well, focusing on improvements for walking and biking for residents of all abilities. Here's some that we did in Proctor. Evaluate opportunities for CSA's activities, which provide healthy food options. We're starting to see that not every community, especially that we work with, can support a full-on farmers market. You know, farmers are having to kind of pick and choose where they're going, not being able to, if they can't necessarily go to every single farmers market available. Some had started Proctor, I think it had one for a few years, and it just they had gone into Duluth, those farmers had gone into Duluth just because it worked out better. CSAs seem to be a little bit more viable of an option for a lot of the communities we work with, so we're starting to guide them kind of down that path a little bit more. And from the city side of things, it's just providing an open space for that to happen, just supporting that, not necessarily organizing it, being the driver, but making that part of your community vision to provide what you can and support something like that. Pocket parks and natural playscapes, low maintenance, native plants and few man-made components just to have kind of that open green space within the community is something else that we brought into, this was recreation and cultural resources, I believe. Tourism and natural resources too, here kind of what we had for community gardens, use public meetings to identify needs or potential sites, address and revise any land use zoning, as I mentioned earlier, to make that an allowable use if necessary, and then work with local interest groups to develop maintenance, distribution, use partnerships, to be able to maintain those things going forward, have that set up prior to and not just kind of making it up as you go along, is much more sustainable practice. Connecting in new neighborhoods, public facilities, parks and schools and other destinations to the sidewalk and trail system. Bringing that into transportation section. We put together, and I'll have a map of it next, for all the communities we were doing comprehensive plans for. We sent out an employee. We had one of the apps that we had mentioned earlier where you kind of type in parking, I would think it was. This was for sidewalk conditions. We basically had a scale 0 through 3. Had a various defined and had somebody walk each of the sidewalks within all the communities and kind of type that in. So we got a big database that has all the existing conditions of sidewalks. So using that system to try to identify existing conditions, missing gaps, big areas that are of destinations that have a big missing gap, to try to connect those when it comes to building sidewalks around schools and transit stops and replacing failing infrastructure. And coordinating with us to keep that updated. If they put in a sidewalk, letting us know so we can update our map. So talking about identifying those dangerous intersections and working to improve them. This kind of came out all right. So this is an example of what we did for Proctor. So the green, yellow, and red and blue are the different existing conditions, excellent, good, and fair, and poor. And then we actually had the help of the MIC, a transportation agency, and ARDC, because they're within their jurisdiction, they were part of this project, help put priorities on some of these missing connections. So you can see that bus stops are identified as well on this, but helping put a 1 and 2 priority on that map to help guide those investments as well. Traffic calming measures was another thing, and this is not from a pilot project, but a different project that we worked on. using temporary materials was something that we stressed. Tactical urbanism is the new planning term that it gets used as. Marin mentioned that active living grant Blue Cross Blue Shield has available, kind of temporarily trying things out. We were actually able to get this language in La Prairie's comprehensive plan, and they undertook with Blue Cross Blue Shield funding, just based out of what Gitford Itasca does, their own temporary round mini circle within a neighborhood. You can see a trash bag over the stop sign, their own roundabout.
Do they know how that worked?
I think it actually worked pretty well from what I've heard from Grand Rapids.
It worked at first, but then,
Okay, I haven't heard for a while.
so what happened was people complained that it was too wide and that it was making them slow down going through the intersection too much. So then the city, correct. So then the city decided to tighten up the radius instead of what the standard, because I think they used the city of Seattle put together. Yeah, so then it basically became an uncontrolled intersection, and it's since lost a lot of the initial kind of momentum that the idea had, which is frustrating, but a lesson learned certainly as well. Stick to the standards if you're going to try something like that. Again, I touched on the access survey, 1,200 surveys mailed out. Between Tower and Mountain Iron, asking about shopping and transportation, food preparation and storage, those kind of things. Got about a 30% response rate. I don't think we tapped into the target audience we were hoping to, though, just because we ended up we had many respondents that were multiple car users driving to regional centers. We thought that there was a little bit of a little demographic that we were missing, with maybe seniors, single parent families, things like that. So we were able to follow up with AEOA, who has connections to those demographics, and the university has just last week conducted a focus group with some seniors. Are working on and conducting another one with some single parent families, ideally, to try to help get that qualitative knowledge, qualitative data, on what kind of barriers that the range is working with when it comes to food access. Again, I touched on that checklist as next up, tool to review comp plans. Planners and public health staff can both use. You pick up somebody's comprehensive plan and can really easily see some areas of improvement that they need to improve. Also, Blue Cross Blue Shield is in the process of putting together a document full of template language to integrate into plans, kind of a best practices, if you will, where this checklist we're developing is just kind of a way to evaluate something. This will be, if you're undertaking your plan, well, this is the best policy language to undertake connecting sidewalks or community gardens or something like that. So another resource that'll be available moving forward. Increased community engagement helps a lot, and it shows the need to consider health. Like I mentioned before, bringing CHP and public health into that conversation to help bolster just the knowledge and capacity when you're having that conversation helps a lot. Learning how to incorporate the health data and language into the process has been a learning component. Into the document too is kind of something we've been back and forth with. Is that something that necessarily needs to be in the comprehensive plan document itself? The cities we've worked with have kind of been back and forth, tentative to bring that stuff in there, but at least presenting it during the process is important. Zoning is a big area of it that you can actually make an impact, so that's another thing that's coming out of it. Just raising awareness about infusing health into their community visioning and planning process. That mini circle that we saw earlier, they would never have been able to pilot that without having an active SHIP coordinator at the planning process the whole time. We end up working kind of consultant-ish when it comes to some of these, where we do the planning process, and then we're on to our next project. So seeing some of those things all the way through can be a little bit more difficult when it comes to the actual implementation. So that's where, if you're building that public health relationship throughout that planning process, they can kind of pick it up after you help them get to the adoption phase of the plan and actually implement some of these things, which is what we're really trying to stress. Research, so this is where I was, with different people, public health or who was going to be here, looking into when the community's existing comprehensive plan, trying to connect with local planners. When will that planning process begin? Trying to prepare for that. If you're public health or interested in bringing that in, some of the questions to ask. Educate yourself on the planning world. Understanding politically and legally, there's only so much that we end up being able to do. So working with public health or other officials, having them understand our limitations helps a lot too. again, guide decision making at the local government level. It can be a once in a decade or once in a 5 to 10 year opportunity to reshift this whole planning process of what your community vision is. So being able to have that conversation early, I think is really important. And also fostering relationships between public health planners and the city in general. Having them be a part of those conversations can really help have that planning process be a reason for fostering relationships to work together moving forward.